Bospiros.
Casey Kendall.
Insurance Bros.
How you doing, man?
We are here. Season 2, Episode 3. We missed last week. I apologize.
Yeah, I know, right? Busy.
We do have a live audience with us.
We do have
today.
a live audience.
My mom,
Yeah.
Lee, and her partner, Carol. Thank you guys for being here. They're not on camera.
Thank you.
But I'm actually really glad that they're here because Carol, and I'm allowed to say this because it's been a topic, is now 64 and a half.
Oh, well, happy birthday. Getting close there.
So you know what that means.
Someone's turning 65 soon.
65 soon. So,
Yeah.
Medicare.
Right. So, a live question audience about Medicare.
Okay. Let's do this. This is really, really exciting. So, why don't let's walk through, Voss, what it looks like for your Medicare process. So when you meet someone who is a few months away from turning 65, what is or should be their plan?
You know what? Their plan should be, first off, to see if you're going to still work, and then if you're going to take your Social Security or not. So if you're not taking Social Security, then you're not going to get automatically signed up for Medicare. So
Okay.
if you're on Social Security, you will automatically get signed up for Medicare.
Interesting.
Right? So keep that in mind. If you're
I have a question about that then.
Oh, okay. Yes. Here we go.
So if you're automatically signed up for, if you take the first disbursement, right, of Social Security, then you're automatically signed up for Medicare.
Well, it takes like 4 months of Social Security, being on Social Security before they'll put you on Medicare. So they won't roll you on the same day unless if you turn 65, you call up and say, I want to go on Social Security and Medicare.
Mm-hmm.
But if you took Social Security at 62 or 63 or 64, and you turn 65 and you're on Social Security, they would issue you your Medicare card.
But then, do you have to go in and pick your plan? So you're automatically on A, right?
A and B. So
they'll
put you on B, because B you pay for monthly. It's $185. You pay for B. Since we worked and paid in Medicare taxes, Part A is covered. So if you're on Social Security, they are already paying you. They'll send you A and B and start pulling money out for Part B.
So then the average person would have to then select a D part, Medicare D.
Right. So they would need, if they're on Medicare, Medicare's an 80-20. So at that point, they cover 80%, you're responsible for 20%. And to cover the 20%, you either go on a supplement, Plan G, or Medicare Advantage. So with the Plan G, you would go on a Part D prescription drug. But yes, when you go on Medicare, you need to go on Part D drug plan to avoid penalties in the future.
That's how I remembered the Medicare, because it's a pretty big part of the insurance test.
Yes.
Is Medicare. And I actually had to create a table, and the way I remembered Medicare D was for drugs.
Yes, that's a good.
But then G could be like, well, it's going to cost you money. It's going to cost you a G.
A G.
Yeah.
Well, I mean, it probably will over the course of the year, but.
There is something new, though, and I don't want to get ahead of ourselves.
Oh, yeah.
But I think that there's limits that have now been put on the amount out of pocket. So you mentioned 80-20.
Right.
But isn't there a limit on what your spend would be?
So on a supplement plan, you pay monthly, and then you pay your Part B deductible of like $257, and then there's no co-payments past that on a Plan G. You pay your Part D premium, and there's co-payments for your drugs, yes, but for healthcare, no co-payments on a Plan G. So, but on a Medicare Advantage plan, there is a maximum out of pocket.
Okay, that's what I'm thinking of.
Right. So there's no cost. There's generally no cost for the Advantage plan, but then there's co-payments for service. So supplement monthly, no co-payments. Advantage, no monthly co-payments.
Can I lay out a scenario?
Yeah, lay it out.
Okay,
Drop
perfect.
it down.
All right. 64-and-a-half-year-old young woman, still active, still working, took Social Security at 62 to maximize benefits, is going to have to sign up, but is still actively working and all those types of things. What is their approach? What's their plan?
So there's actually still a couple options. If you don't want to go on Medicare, you call the Social Security Department and say, hey, I don't want to go on Medicare when I turn 65. So you can keep your work insurance. Yes. If you want to go on Medicare, it'll automatically put you on it, and then you would pick a supplement or an Advantage plan to go with the Medicare plan.
Do you have to, what happens with the work plan, the work benefits, so to speak?
Right.
Do you have to take those over others, or are they, what am I trying to say here? Like, one cancels out the other, like you can't gap it.
Right. So if you're getting healthcare through work and then you go on Medicare, Medicare becomes your primary. If you keep your work insurance, you're paying for nothing at that point. So it's kind of like,
so you could drop all your work stuff.
You would drop your work health insurance.
Okay.
Yes. I mean, if you're getting dental, vision, hearing through work for a couple bucks a month, you can keep that. That's not going to be a problem. Even if you get an Advantage plan.
Or like voluntary benefits, which those are the dollar, the few cents at the bottom.
Right.
I mean, disability and
all those benefits you keep. The only thing you would drop is your work health insurance.
Major medical.
And you keep all the other disability, life insurance, dental, vision, stuff like that.
Nice.
Yeah. If you're a government employee, it's a little...
You're fired.
You're fired. Yeah. They have a group plan. So at that point, it's with your benefit package. It's good to stay internal. So if you retire from your company and they have a Medicare plan that goes for the retirees, then it's kind of good to stay with your work plan, group plan, because if you drop that, you might not be able to go back to it later if you want it, like if it's really good. But you can look at plans outside, and by all means, you have access to all those as well, but you need to look at your HR, talk to your HR department and see what benefits, what plan is available through work, what they're going to cover, and what the plan covers before you go outside to a broker and start looking at your own, because maybe they're going to cover part of your co-payments. Like they were paying your premium prior, but now there's no premium on an Advantage, so they're going to put money towards your co-payments. I mean, that's a pretty good deal, because now you get a better plan than everybody else.
It seems to me that even though everyone still has to do all of this, right? You paid into it, all that kind of stuff. It seems to me that these are still what I'd call snowflake situations, meaning everyone is different in some form or fashion.
Yes, everything is different. There's a lot of variables that go into this.
No two situations alike.
Not really, unless you get two employees that are twins from the same company. I mean, then that might be pretty close to the same. But no, not too often.
Let's talk about this. Let's talk about what are some things that either people wish they knew after signing up or before they signed up? Like any gotcha type of stuff or loopholes or any of that?
The Medicare supplement, there's no underwriting at 65. So if you're going on Part B for the first time, there's no underwriting for going on Part B the first time.
It's a risk pool.
Right. So they're normally outside of your initial enrollment period, anything past going on at Medicare for the first time, it's medically underwritten for age and health. So if you're sick, you can't get it. Right. You can go to straight Medicare, but then it's just the 80/20 coverage. And the 20 is on the provider's side. So the Part A has a deductible of like $1,600, and then, that's for the hospital stay. And then you pay that and you're good for 60 days. But you could keep paying that every time you go back to the hospital.
Are there hospital plans associated with it?
Well,
I've seen like in the past where it's like you can go to this hospital and that's it.
So on straight Medicare, you can go to any doctor or hospital you want.
Mm-hmm.
There's a hospital indemnity plan you can get to cover the hospital costs, the out-of-pocket costs. The 20% on the 80/20 is mainly on the provider side. So every doctor or person that you meet with through your healthcare is going to charge 20%. You're going to have to pay 20% of that cost. So when they say a hospital stay, the hospital is covered by Part A. You pay your $1,600. The hospital is. The providers, the people that work there,
they're all like independent contractors.
Right.
Yeah.
So they're all billing Part B. They're 100%, and you're covering 20% cost of that. So a $100,000 bill is $20,000. So if you have a supplement plan, you pay your monthly premium, and you can see any doctor you want, any hospital. You can spend as much time as you want in there, and you're covered because the G is paying all your co-payments for it. So it's great. So the gotcha moment would be, hey, you could have had this plan, but now you're sick and you can't, and you're on Advantage. The Advantage plans are great. People give them a bad name because the guys that sell supplements aren't licensed to sell Advantage. So I have a life and health, right?
Mm-hmm.
But we're also, certified with, not CMS, but with CMS for compliance reasons to sell Medicare.
Oh.
Advantage plans are Medicare. Insurance companies contracted with the government to sell Medicare, and we're contracted with the government and the insurance companies to offer the plans. So we are Medicare insurance agents. The other guys are just supplement. They can go knock on your door. They can bug you. There's no compliance there. And everything under the sun is, the greatest things in sliced bread. You're paying $500 a month for $1,000 a month for your commercial health insurance. Now the $185 plus $170 for the supplement plus $30 for the D, you're like $300-400. That's cheaper. Just get that. And the advantage is the advantage of the Advantage plan. It includes Part A and B and D. Not all the time, but in D, into one plan with no premium. You still pay the $185 for Part B. Everyone pays that. And that's based on income, so that's a whole other topic.
Is that a month? It
is, $185 a month for Part B. But the Advantage is like our current plans, our current health insurance. It's a in-network HMOs and PPOs. So in-network doctors, if you want to see a doctor, a specialist, you get a referral. Most of the Advantage plans don't require a referral anymore on the HMO side, which is nice. But then they made a PPO version, and the PPO is in network and out of network.
Okay.
So it's like the supplement is good anywhere in the country, anybody that takes Medicare. The PPO is good anywhere in the country, anybody that takes Medicare. There's a higher co-payment for the PPO out of network than it is for the HMO, than for the in-network doctors. But you still have access.
That would be good if you're like, you're traveling around or, got yourself an RV or something. Right. And you're like, oh my gosh, I'm in Indiana.
Well, it's like if you're living in two states, the supplement plan's great because...
Oh, yeah, snowbird situation.
Well, right, because you're going to have doctors in both states and providers and healthcare in both states. If you're just traveling, then every plan has emergency coverage, all the Advantage plans. Emergency coverage on Advantage is technically worldwide at that point.
So it sounds like to me that in the situation that I laid out, right, about to be 65, still fully employed, they could essentially go to their employer and say, thanks, where do I sign? I've now had a life event. I'm gonna
Well, right.
discontinue, and I'm going to pick up my Medicare plan, and then choose what I want to do.
So if they if their company doesn't offer Medicare, or the benefits not that great in comparison to the outside stuff, yeah. So when they get ready to retire, or they just go on Medicare, then they say no more work insurance, and I'm going to find a plan that works best for me out of all these other plans. The work insurance ones are good, but they're really contracted with one carrier for everybody, so it's a one size shoe fits all.
Mm-hmm.
But in Arizona, there's 100 plus different Medicare Advantage plans, and then all the supplement plans. So
really, you would take in all the variables and all and be able to make the determination of, this is the right one for you.
Right. So we sit down and look at their doctors and the prescription drugs, and their health care and what's going on, and if they're traveling, and their income, basically, because there's a cost for healthcare. So we look at the variables. If they're only living in one state and they're not moving, and they just kind of stay around and see the same doctor all the time, and they're not on a lot of drugs, maybe the Advantage plan, because it's like their current health plan, but it's not. But if they're going to travel at 65, you're getting close to retirement, you're going to work a few more years, but you're going to travel, that's your goal.
Well, it seems like that retirement age keeps getting pushed out. I think it's at
what's that,
72 or something?
Well, so full retirement age is 67 now.
Okay. By the time it's for us, it'll be
70.
It'll be 108.
Right. Yeah.
108.
It's ridiculous.
Retire.
So the 100% for your Social Security is 67. When you hit that mark, then you get your full retirement. It's not 65 anymore. It's 67.
Let's switch gears a little bit. I appreciate you breaking that down. Any questions from the live studio audience? No. Okay. Perfect.
No? Okay.
Thank you. Let's switch gears a little bit, because I was actually having a conversation last night, and we were talking about adult companionship and what that means to
those robots
user. No, not so much like a robot, not like Rosie from the Jetsons. Not like AI, where it's hey, hello Casey, how can I help you today? And I'm like, hello Rosie. I was thinking more like if you're a senior, and we've had them on the shows, on this show before.
Seniors?
Well, no, but senior, adult companionship. You've got non-medical, you've got medical. But somebody asked me, what's the definition of light housekeeping? So maybe we pose that to the audience.
Yeah, what do they think?
If you're in adult companionship and non-medical, where's the line?
Well,
in light housekeeping.
Well, light housekeeping is different than medical.
Well, yeah, of course.
Right.
So medical heavy housekeeping?
No, medical is medical, right? So there's non-medical home health care and housekeeping, and there's medical. So somebody coming in and doing wounds and physical therapy.
Oh, yeah, sure. That's a lot different.
That's medical.
Yeah.
So anything past that, laundry and dishes and cooking and
keeping you awake or telling you it's nap time, or
up and down and picking people up and putting them on the toilet and moving them around and brushing teeth.
There's 5 functions, right? Something like
the
that.
ADLs.
Yeah.
Activities of daily living. Yeah.
Okay. That's what I thought.
What things do you not like to do?
Well, it's not it's I'm still employed.
Or can't.
Services that she could inquire about, but one of those was the light housekeeping, and she pays for someone to come in now and clean the house 2-3 times a week, plus she's got the little floor robot. So if her Kaiser would cover that, if she's got Kaiser through her Medicare, what would that entail? Would the person come in and do dishes for us? Would they mop the floor?
So I'm not sure what Kaiser's benefit is on that one, but the majority of the benefits I've seen on that, it's a newer benefit in the last few years that insurance plans are offering. And it's really only, like the biggest one I've seen is 60 hours a year. So that's not a lot, but they'll come in and do some, light housekeeping, vacuum and clean up and mop, do some dishes, little things like that. They have a non-medical built in for, getting out of bed and helping them move around.
Yeah, that's
Activities.
Right. But it's
getting the dishes done, and there's the disconnect here of I pre-wash the dishes because the dishwasher isn't capable.
right.
And the dishes don't get rinsed, and the little jets get plugged on the dishwasher. Dishes don't get cleaned; they get put right back in the cabinet.
Sounds like you need a plumber.
Sounds like a little CLR in there would be go a long way.
Got that hard water out there, Mom.
Take the, get a
Yeah.
pick the food out of the chips, and
Yeah.
but it's if someone was to come in and help with the dishes, it wouldn't be,
So let's kind of shift gears a little bit here.
Okay.
So
Yes.
in an adult companionship situation, medical, non-medical, those would be covered by a Medicare program. No, really?
Well, not 100% of it. No.
Okay.
Like maybe a couple hours a month. I mean, what's 60 divided by 12?
52 weeks.
52 weeks divided by 52 would be like an hour a week, maybe hour and a half.
Well, but I was more concerned about like not so much the light housekeeping, but just the overall experience. Would that be covered under Medicare? Is there a specific supplement or a plan, or is that an all out of pocket thing,
So
or part of your medical plan?
straight Medicare doesn't cover non-medical items. So A and B and a supplement, that'll never be covered there. I mean, it might be, but it's really not because it's not healthcare related. So it's a benefit offered through Advantage plans, through insurance companies, and then it's a small one to begin with, but it'll cover something, an hour a week maybe.
Sure.
And coming in and doing some of the house cleaning, the chores. Yeah, absolutely.
Yeah.
But on a more daily basis, you're looking at $30 an hour for someone to come in on the low end to help out.
I think what this conversation has proved.
You get a live-in nanny, right?
There you go. Yeah.
Yeah.
I think that what this has proved is that it's extremely complicated.
Well, it is complicated.
And that you should have a professional walk you through the entire process and be available for any type of question.
Definitely work with a broker.
Yeah.
And I say broker because we're brokers and we contract with 16, 20 different carriers to offer a variety of whatever fits you best. An agent sometimes only works with one or two carriers, and then you're kind of, this one works best for you. But do you really know? Because they can only pick from one or two.
Yeah, their options are limited.
Right. And then there's the captive agents that work for a company only, and that's all so if you have if you're, no offense to the carriers, but if you get on the phone and someone says, I work with Humana, ask them what other companies they work with. And if they don't, then say, thank you.
They're only working with that one.
Right.
And that could be a situation where
United Healthcare,
you're going to get shoved into that square peg no matter what size you are.
Right. So the bigger carriers have internal agents, and if you call them, you're going to talk to them only, and they're going to review their plans only for you.
We've talked about some of the ramifications
Fine, they have great plans
of not having or not going through the process. What does that look like? Isn't it like you get fined forever?
Well, yeah, it does. So I was at the conference the other day, and I was talking to an assisted living homeowner, and and saying, letting them know that, we help out with this, help getting people on Medicare. And they're like, well, can't people just do it themselves? I'm like, absolutely they can. They can go through, Medicare.gov and sign up for their Medicare and then figure out the rest. Well, isn't that easier for them than going through you? I'm like, well, maybe.
That seems like I'm like, stick your head up the bowl to check out the T-bone or take the butcher's word for it.
Right, yes. Yes, Tommy boy.
That's just me.
I'm like, absolutely. I mean, if you want to go in and do the work and do the research, the Medicare.gov has that program available. It's a little confusing if you don't use it all the time. But then you're not going to get a overview of all the plans, from somebody else who works in the area. You don't have any backup on that. And if you miss something and you don't get a Part D, then you get a penalty after 63 days.
Oh, wow.
So your penalty is for 1% of the average cost for as many months as you don't have it. So I met with a client. Well, I have a client that's on a Medicare Advantage only plan, not a Part D, because back when they turned 65, they weren't taking any drugs, and they're like, well, I don't need this. I don't need the Part D plan. So they never got it. So like 10 years later, they're like, I need a drug plan. I'm like, well, okay, so that's 33 cents times, how many months?
360 months.
And this is now your new bill on top of the cost of the Part D plan, on top of the co-payments for the drugs. So you have to pay the penalty to have it for as long as you keep the plan. So then Part A has a penalty. Yes. Part B has a penalty. Part B, people don't go on Part B sometimes because they get to that point, Part A is free, and they're like, well, I don't want to pay for Part B. I'm like, okay, you don't want to pay for Part B. If you're on Part A, you can still get a Part D plan for drugs, so you have your hospitals and drugs covered, and you're like, I'm not paying the $185. So then they're like, well, now I need a Part B. So I'm like, okay. So that's 10% of the cost, the monthly cost over the year. So
would that be like if
many years as you haven't had it? So
if they had a job.
So like, yeah, 10% of 185, $18 times
the amount of
number of years you didn't take it.
Wow.
And that's your penalty that you have for life going on Part B.
So it automatically would add like $20
to your 180 to your current Part B premium, 185. Yeah.
Crazy.
Yeah. So then, Part A is like 10% of every 2 years. Well, 10% of the premium is $50 for every 2 years you don't take it. So you don't take Part A if you never worked and paid into Medicare, because then Part A is $550 a month. Wow. Right. So if you're a stay-at-home mom, right, and you never worked and paid into it, you don't get Part A. But then they're like, well, I don't get anything either. Like, no, if you were married for at least 10 years, you get half of your spouse's Social Security. It doesn't come out of their Social Security. It's just the number they get. And then you can use that to pay for the Part A.
Oh.
So, I mean, you can still get Part A and get it covered. It's just, a little bit more to do.
What's the work expectation? I feel like if I recall, it was like you have to do like 40 quarters.
Yeah.
Which is about 10 years.
10 years.
10 years.
Yeah.
Yeah, it's just keep a job for 10 years.
Basically. Yeah. Yeah, and it's actually, it's not even, so it's 40 quarters, and I think the minimum amount of money you have to make in a quarter is $1,000 or like $1,500.
Oh, wow.
So really it's not much.
Yeah.
To just earn a little bit of money every month, and you can have Part A.
So we had a conference this week on Wednesday. We had the Aloha conference, always a good event.
Yeah.
What else you got coming up in the next few weeks?
Well, we have the Senior Healthcare Solutions monthly mixer
In May
20th at Park Terrace in North Phoenix.
at the Spiros.
No, not that one.
Oh, no.
Yeah. So we got a few things. This month is March, right? We're in March.
March.
So in March, we have our monthly mixer. And then in May is our next conference, May 13th.
Got it.
At the Spiros Center.
Yes.
My grandfather built.
It's like Staples Center, the Forum, the Spiros Center.
Right. We're right there with the Staples Center. Definitely. Yeah.
Absolutely.
Yeah.
Absolutely. I remember the first time I pulled up and I was like, I know that guy.
I know that guy. Yeah. It's my great grandfather.
That's amazing.
Yeah. Donated a bunch of money to the church when he passed. And then my grandfather built the church. So, yeah. We got our name everywhere over there.
You have any happy hours coming up?
Yeah, on the 20th.
The 20th. Where's that at?
The Park Terrace.
Okay, that's the one you're
That's
talking
the happy
about.
hour.
Got it.
Yeah, and then we have an agent happy hour the day before on the 19th for insurance agents. Anybody want to come out and mix and mingle?
Always looking to grow the team.
Brokers. Yeah.
Yeah. I need still in that ramp up for an admin, but I'm actively looking for some producers.
Yeah.
And to expand. If anyone wants to discuss that, I just opened up a market in Texas.
Did you?
And I put my first assisted living policy in Texas.
Nice.
It's not quite as strict as Arizona, so if anybody has any questions about that, let me know. I'll spit out some sentence fragments and light things on fire for you.
Yeah, I been recruiting pretty heavily.
Nice.
And now we have agents in California, New Mexico, Idaho, Oklahoma, and Texas.
Wow.
So I could probably help you out with those assisted livings with the Texas agent that does pre-need. So
awesome.
Yeah.
Well, I really appreciate all the information you shared with us.
Yeah. What's going on with you? Anything coming up for you?
No. I'm still working. We talked about the assisted living programs that we're working on.
Yeah.
We pretty much have that all in place.
That's good.
I do have one question for Access, and I'm waiting for them to get back to me.
That's good.
It's more of a compliance issue. They're probably not going to like me very much, but it is in the advantage of the assisted living homeowner and the patient. And I'm seeking some clarification on a few separate things.
That's good.
But we're rocking and rolling. We've got that program in place. It's extremely affordable. You'll stay in compliance. Altix, Access, United Healthcare, any major program here in Arizona. And you can rest assured that whatever happens within your house, in your control or out of your control, you will be covered.
That's good. And you're going to come to the conference.
Yeah.
So I heard through the grapevine that you're going to be at our next conference talking about
it. That's what I heard as well. Right, so that is another thing that I'm working on. We are going to do a presentation. So we're going to, I would imagine it's probably going to be an hour.
About 45 minutes.
Okay, 45 minutes.
An hour.
Which will go really, really fast. And I'm going to make insurance as fun as possible for everyone. But we're going to break it down at the deepest level. I think a large group can do. But we're gonna cover the real basis, and I'll lay out some scenarios. I'll start working on that this weekend.
That'll be good. I look forward to that. And that will be a CEU for anybody that comes to the conference. There's 6 CEUs, and that will be one of them.
Sweet. And because continuing education has kind of evolved here in Arizona.
For the managers, and
it's like a monthly thing?
It's a monthly thing. They need 24 hours a year, I think.
Okay, so you got to ramp it up.
Yeah, so we're doing 6 a quarter.
Okay. Just come to our events and
you're pretty much
events and you'll be fine.
Well, we're doing 3 quarters and then the Christmas party.
Sweet.
Right.
Okay.
Yeah. So for the senior healthcare and Arizona Senior Services.
So we'll both have a booth there. Plus, Red Mountain Funeral Home will have a booth there.
Right. Yeah.
So Arizona Financial Solutions, the Medicare will have a booth there.
Medicare and the funeral home have a booth together.
Okay, perfect.
Yeah.
Prosperity North will have a booth there.
And we will be doing the podcast there as well.
Yes.
Yeah.
Yep. And we're going to do the podcast. So we're going to have probably 4 microphone setup. So 1, 2, and then we can have up to 2 guests at any given time.
Right, yeah.
If somebody wants to share a mic,
Come on out.
If you're there, sign up. But we're going to start talking about that, getting the word out for that. So if you've got a message, just share, whether you're a vendor, whether you have questions that you want asked on the show. We'll do that, but it will be a live situation directly from the conference. So I think that's going to be a lot of fun.
That'll be a lot of fun. Yes, absolutely.
I'm looking forward to that.
Right.
So I appreciate your time. Wealth of knowledge is always
good chatting.
I every time we have an interaction and have a conversation, I always learn something, and I really appreciate not only where you come from and your perspective, but you as an individual. And I thank you for that.
Yeah.
My name is Casey Kendall, Prosperity North Advisors, Gilbert, Arizona. We do all your commercial insurance for your business, whether that's assisted living or any type of business.
Voss, Arizona Medicare, Spiros Financial, and Red Mountain Funeral Home. So if you have any funeral home questions, let us know, and Medicare is what we do. So I hope you have a wonderful day, and we'll see you soon.
Have a good one.